Hi there, I'm here with beautiful, most elegant Simone Harris. Now let me tell you about Simone. She is an entrepreneur, she's a life coach, and she teaches yoga. Actually, I follow Simone in her teachings, and she's probably one of my mentors in terms of what I like to see and learn, and she calms me down. You're not supposed to calm people down, you realize that, don't you? Okay, but she calms me down. Now, Simone, what was it, 22 years ago, in 1997?
1997.
All right.
Yeah.
Now, this video is going to tell you that people after 22 years can look actually younger and youthful and more attractive than they were 22 years ago, okay, today. So let's just, Simone, look, you tell me exactly, remember you went, tell me the story.
That's the first time I've seen my mouth
Yeah.
since she transformed it back in 1997. I can't believe it. So I have to say, looking at that, I spent my whole life being called gummy at school. Even I had braces. So I was always paranoid and I never smiled. I very rarely smiled because I was paranoid about my mouth. So I searched for someone to help me, and I actually went to a periodontist. And he said he could lift it by a millimetre, but it would cost me around 20,000 or 30,000, something ridiculous back then. And it would be really.
That was 22 years ago. That was 22 years ago.
Yeah.
Interesting. I mean, this is important to understand. What were the most important thing? What did we do for you at the time? I mean, maybe you can explain.
Well, I found you. I just had a really good feeling. You were on the front of a magazine. I was at a beautician, and I thought, I've got to speak to this guy who knows what he's doing. And I came and you just calmed me and said, this is what we can do. And you basically did the procedure in one day. And
after the diagnostics,
you were so advanced. And it was one, I don't know, I was here for probably 4 hours maybe that day. So
we did a gum lift and we did the composite veneers. And this after it's healed. I mean, it makes a difference. You still look good. This is 22 years after.
Yes, so hitting 50 now.
Hitting 50 now. Can you look in the camera and tell them that you're 50 because you're awesome. I think you look good. That's my opinion. I mean, my viewers say to me, you know, you have all these beautiful women that you treat. Of course I treat beautiful women. They are beautiful. I mean, they are good looking. They want to look at life and look at all the positive aspects of life. We all have problems in life. And we just deal with it, don't we? Really.
Totally. And I think that sort of, like, to me, I do want to look and feel my best. So I want to come to a person I trust and I know I'll get a great result from.
Thank you very much. I appreciate that. Now, learn from here. Remember how we discussed this? Tell me a bit more about it. If you see how small the teeth were, how we improved the gum line, and we did this, quite creating a symmetry and creating a harmony. This is all to complement your facial aesthetics, because your face and your teeth, they're in proportion, and everyone's a prototype. Everyone is a prototype. So when you talk about this digital smile design, people talk about it's absolute crap. Do you see what I mean? Because you can't look like some sort of computer library image that they promote. And if you look very, very carefully here, and then you can see the difference, what we've achieved from here to there. And that's really important. So I'm just thinking about this.
That's unbelievable what you've done. That's unbelievable.
Just looking at it proportion-wise, how we improved the whole flow, how we created that important flow for you. And then we went back, and you can see the difference between from here to there.
And you also made a note about the colour of my skin.
Right.
So you wanted it more of a bluer reflection for the veneer.
That's right.
So you wanted to tone it into my colour, which...
It looks good. After 23 years, it still looks good. I mean, you can view and smile at my views. I think it looks fantastic. You know what I mean? And you got good aesthetics about you. And you project good energies, and that's why I like you very much. Your energy is awesome, and that's really important to know. Thank you. And so we went from here. Remember that picture? How this is 22 years ago. Now, can you see that picture and look at this beautiful girl? I mean, this is 22 years. I reckon she looks at the moment 22 years younger than before. Would you agree? All right. We transfer you from here, right? In that time, okay. Do you know why does this happen? Do you know why does it happen? I mean, there's no facial augmentation here.
No, that's
okay. You've never done anything like that. I know you. Okay, you're all natural. All right. Now, how does this look better by transforming the teeth, how does it make the face look better? Did you ever
It's just
think
balanced, yeah, it's so balanced.
The most important thing I find, and I keep saying to my patients, is when we look at the world through the eyes of our brain looks at the world through the eyes. When the eye looks at the mirror and says the brain is happy what they see, it readjusts all the facial muscles. And it creates this beautiful effect, which is called aesthetics. You know what I mean? And this is so natural. How we've given the tone, like you said, the tone of the smile line, the actual Veneersmod gum lift, it's all in concert with you. You know?
Definitely.
I've seen you, you come a long way, I must say.
I can't believe it.
You've come a long way. You're a
Thank
beautiful
you.
person. The effect is good, and thanks for being part of my practice. I'm grateful.
Thank you. You did change my life, and just showed I always had that in my mind, how paranoid and embarrassed I was, and I would not smile. So now I do.
I'll tell you, you look, although it's been 22 years, but compared to that picture, you look 22 years younger. Okay,
Thank you.
We can't change chronology. We can certainly maintain improved biology, and I think you've proved it. And this should be as part of your life coaching to your clients to show them before and after.
Definitely.
That's really, really big improvement.
Yeah, and thank you.
My pleasure. What was the most important thing in terms of your treatment you say to the viewers and my colleagues and also viewers, in terms of how do we as professionals should be approaching patients for treating you? How do we, what would be something that would be important you would say to point out? This is what we should be teaching and doing to help our patients achieve better outcomes.
Listening to what they want, but also being the expert to say, looking at the face, to say this is what I believe you should do and what I can do for you. And like you said, the tone of the colour and the personality, and just chat to the patient first and find out where it can fit.
Absolutely. Well, I want to thank everyone here. All right. I'm going to send this video to you. You can post or link it. I mean, that's wonderful. You look fantastic.
Thanks, Sam.
My pleasure. Vivek, I like a photo. Take that photo. This is good?
Yes.